Welcome to the Global Integral Beauty Networking event, an innovative platform that seeks the best professionals from the global industry to connect and build an interdisciplinary community working together for the benefit of patients. Hosted by Adalis Bailey, global leader in the integral beauty field, a registered nurse with an MBA in marketing, skincare specialist, and CEO of Renew Aesthetics. Adalis Beauty Savvy and Global Integral Beauty, also a best-selling author. This is a revolutionary opportunity to create professional networks in the fields of health, wellness, and aesthetics, driving global collaboration. Get ready to enjoy an event full of connections, knowledge, and innovation. Welcome to the Global Integral Beauty Networking.
So our topic today is innovating an aesthetic approach for veins. We have the experts today and we can discuss just a few questions about one patient. We have a panel. We're going to enjoy this time with these three VIP guests. We are going to do the presentation, discussion panel. This is the topic that I'm talking about. If you have a question, you can bring the question with the audience.
Well, I appreciate the medical history and the family history as well. I always sit down with each patient for a good 10 to 15 minutes and review what is going on in their life. And saying that she has a sedentary lifestyle, the first thing I would go over is I would review if she does any exercise at all. And I would also suggest in that vein that even having a sedentary lifestyle, she can do simple things even during the day, get up and take a short walk, calf raises at her desk, elevate her legs. And if she even gets enjoyment out of walking 3 to 5 times a week, and we want to move our blood upwards, so swimming is really good, and try not to cross your legs. So I start with an exercise routine because I do think that can help since she does have a sedentary lifestyle.
Yeah, so patients like this is what I see pretty much all the time. So very important, the family history, because we know that vein insufficiency is mostly genetics. Then we want to know what is the main concern to the patient so we can address and tailor the treatment to her concern. So she has the cosmetic concern, but also she has some symptoms. A little bit of a perspective, in the past, the only treatment available for patients with vein insufficiency was for those who had big bulging veins, and that was the ligation and stripping. That was extremely painful. You have to be in the hospital and be out of work for a long time. Patients that had any different symptoms like restless leg syndrome, swelling, heaviness, or night cramps without any visible varicose veins were most of the time left untreated because the treatment available was too intense for the symptoms that they had. So a patient like this, the first thing that we can do after we gather all her medical history, we know her goals, is having the ultrasound, which she has there. So her ultrasound shows that she has venous reflux. So when we're treating spider veins, varicose veins, or any symptom, we always treat the patient from the highest point down, the bigger size veins first, and then the smaller veins. So now we have to address the vein insufficiency that she has there, her positive venous saphenous reflux. In the past, it was only ligation and stripping, but now modern medicine has given us an important tool to treat these patients with a procedure that is done in the office under local anesthesia, and the patient can go back to regular activities right away. So that is the endovenous ablation. Around 2000 is when it was widely accepted and adopted, and around 2010 is when it became the gold standard treatment for saphenous vein reflux. Once we have addressed the venous insufficiency and the reflux, then we can go and treat the spider veins, which is the cosmetic concern of the patient. And I can keep going on and on, but just tell me, what else do you want to know?
How do you see the role of advanced skincare protocols and non-invasive technologies complementing medical venous treatments to enhance patient satisfaction and confidence?
So in my office, I have an intense pulse light and also YAG laser. So I treat them at a more actually superficial level than the doctor. I don't have the ultrasound and all of that kind of stuff, but I will use the IPL intense pulse laser for very superficial vessels. And if something's a little bit more invasive, I'll do a YAG 1064 laser. And I have also a cauterizer that I sometimes will close the ends of the vessels off. So that's what I have. I'm very holistic as well. So I love a green LED light that the patient can use at home. We hear a lot about red light for anti-aging. Green is very good for helping to disperse and close the red off on 3 to 5 times a week for 15 to 20 minutes. Also, I suggest compression socks, and I'm very big, like I said, with exercise, but I also love at nighttime, and they could do this as many nights a week as they want, a nice soaking in the tub with Epsom salt and magnesium, and that reduces swelling, and also it can improve circulation. And I love a cooling gel. You can use aloe vera and also a ceramide cream, and then compression socks to help to, compress the vessels. So I'm very big with holistic at home with that. And also diet is very, very big. Water is huge with all of us, of course, but lots of water helps, and also flavonoids and blueberries, strawberries, raspberries, and that helps to support vessel strength as well as dark leafy greens. So I'm very holistic approach as well as trying to, take down the vessels.
For Dr. Claudia Rios, in your medical practice, how do you determine when to recommend sclerotherapy versus laser treatment as the first line option for patients with mild venous reflux and aesthetic concern?
In my practice, for the treatment of spider veins in the legs, sclerotherapy is the gold standard treatment. I do not recommend laser treatments for spider veins on the legs because you always have to treat the feeder veins first, that are the reticular veins, and the laser cannot achieve that. To achieve that is a bigger vessel, so they will have to be higher energy, and you can have more pigmentation, maybe an ulceration, and definitely matting. That's what I see the most. So for the legs, treatment of spider veins on the legs, always sclerotherapy. That's the gold standard treatment. For the face, smaller capillaries, or even the small green veins in the temple areas, we can use laser treatments for that because it's smaller. Any of the laser that were mentioned before. That is how I recommend it in my practice.
So after the treatment, do you recommend aftercare to your patient? How to manage?
For the spider veins in the legs, yeah. So after the treatment, we recommend compression stockings for 48 hours. Basically, when we're using sclerotherapy, we're creating an inflammatory process inside the vein. So we're making the wall of the vein have inflammation for that vein to have scar down and close. And that's the same for any size of vein. Depending on the size of the vein is the method that we use to injure the wall. So when we're injuring the wall, the compression during the first 48 hours is the most important. That's why we recommend to wear compression stockings for 48 hours.
Okay, so I would like to hear today Dr. Claudia. She was with us last year also in the networking, but you have a little bit of experience from last year and this year. Will you share your experiences today? How do you feel to be connecting with Global Interior Beauty? How you can connecting and also explain all the community how important is your name, your expertise, and your brand to be connecting with all the professionals and continue growing together.
Yeah, no, I think it's a beautiful project that you have here, and it's amazing how we can connect with professionals from around the world. So for me, it was amazing and mind-blowing to see all these experts together and supporting each other. I have the most amazing memories from that day. And I think it's amazing what you're doing, the networking. I don't think that you can find this anywhere else.
How do you feel now? Tell me a little bit about your experience.
Oh my goodness, Dallas, thank you so much. It's been a thrill, honestly. I met people last year who I've kept in touch with the entire year, and I cannot wait to see them again this year. So I'm very, very excited. All throughout the year, I've continued to learn from the colleagues that I have become my friends now. So to come back and learn more at the conference and to be able to share my story this year, it's such a thrill to me. And every time you reach out to me, I always tell you, oh, Dallas, I get so excited because I know something really, really valuable and important in my life is coming along with Global Integral Beauty. So I really, truly appreciate you and the entire Global Integral Beauty community.
I just want to hear the experience from Johnson too. Well, how was as a moderator, not as a speaker? How was your experience today, sweetheart?
So last time I was invited to the speaker, and this time I thought it was all about the beauty, but beauty is actually everything, like holistic wellness and outside, inner side. So this is an amazing community that I can learn from all the expertise. And thank you, Idalis, keep on, her team is amazing, that they are promoting us at the same time while we are busy, and we are also promoting them. So it's back and forth. We are still connecting each other. And then this is my first time to participate in the event, and I'm so excited, thrilled about us already. It's blown my mind.